bleeding disorders, what are the treatment options?
So there are multiple options for patients with bleeding disorders, depending on the type of disorders that patients have. For example, if they have got any factor deficiency, what we do is we have something called a replacement therapy. Basically, we replace the factor that they are having deficient. And number two is something we call as DDAVP or Desmopressin. Yeah, so in patients who have got any congenital factor deficiency, what we can do is we can give this medication called Desmopressin. We also have got antifibrinolytic therapy to stop bleeding. Yeah. There are also local therapies that we can do to stop bleeding. For example, local compression, tight bandage, and so forth. Yeah. And of course, when the bleeding is excessive, we can administer blood transfusion to correct the blood loss as quickly as possible. So when it comes to the treatment, it's not only just a single therapy that works. Basically, usually what we tend to do is we give a couple of therapies. We either use in combination or we use one, and then if we don't see a satisfactory results, then we add on therapies. So that's number one. Number two, the duration of therapy depends on the etiology of the disease. So if it's a congenital inherited, then the replacement therapy goes on a routine basis. Yeah. There's no fixed duration. But in case it's an acquired bleeding condition, then it's just used for that temporary moment. Once we have arrested the bleeding, then the treatment basically stops. So most of the time, if it's congenital, it's usually managed and it's an ongoing treatment. Versus if it's an acquired, most of the time it can be treated effectively. It all depends on the type of the bleeding condition that the patient has.